Fluids and electrolytes. Third spacing is the accumulation and sequestration of trapped extracellular fluid in an actual or potential body space as a result of disease or injury. The trapped fluid represents a volume loss and is unavailable for normal physiological processes. Fluids may be trapped in body spaces such as the pericardial, pleural, peritoneal, or joint cavities, the bowel or the abdomen, or within soft tissues after trauma or burns. Edema is an excess accumulation of fluid in the interstitial space, occurs as a result of alteration in oncotic pressure, hydrostatic pressure, capillary permeability, and lymphatic obstruction. Localized edema occurs as a result of traumatic injury from accidents or surgery, local inflammatory processes, or burns. Generalized edema, also called anasarca, is an excessive accumulation of fluid in the interstitial space throughout the body and occurs as a result of conditions such as cardiac, renal, or liver failure. Body fluids. The total amount of body fluids in an adult is 60%. In older adult, 55%. Infant, 80%. Infants and older adults are at higher risk of fluid-related problems than younger adults. Children have a greater proportion of body water than adults, and the older adult has the least proportion of body water. Substances such as glucose, urea, and creatinine does not dissociate in solution. Infants and older adults need to be monitored closely for fluid imbalances. They have the greater risk of fluid overload. Diffusion is the process whereby a solute substance that is dissolved may spread through a solution or solvent. Diffusion is a solute spreads the molecules from an area of higher concentration to an area of lower concentration. Osmotic pressure is the force that draws the solvent from a less concentrated solute through a selective permeable membrane into a more concentrated solute, thus tending to equalize the concentration of a solvent. Osmosis is the movement of solvent molecules across a membrane in response to a concentrated gradient, usually from a solution of lower to one of higher solute concentration. Osmolality refers to how much concentration a solution is. Osmolality refers to the number of osmotically active particles per kilogram of water. Osmolality refers to the concentration of the solution. The normal osmolality of plasma is 270 to 300 milliosmoles per kilogram of water. If the body loses more electrolytes than fluids, as can happen in diarrhea, then the extracellular fluid contains fewer electrolytes or less solute than the intracellular fluid. Fluid and electrolytes must be kept in balance for health. When they remain out of balance, death can occur. Isotonic solutions are equilibrium or equal concentration. They are isotonic. Isotonic solutions are isotonic to human cells and thus very little osmosis occurs. Hypotonic solution. When a solution contains a lower concentration of solute or salt than another, it's considered hypotonic. A hypotonic solution has less salt or less water than an isotonic solution. Hypotonic solution, therefore, has a lower osmolality than body fluid. Hypotonic solution has lower osmolality. Hypertonic solutions. A solution that has a higher concentration of solutes than another, less concentration as a higher osmolality. When the solution of each other's selective permeable membrane are equal in concentration, they are isotonic. Water lost through the skin is called insensible loss. The individual is aware of losing that water. Water loss from the lungs is called insensible loss and is lost through expired air that is saturated with water vapor. The normal fluid intake in a day is 2,300 to 2,900 milliliter. The normal fluid outtake in a day is 2,600 to 3,000 milliliter. The kidney play an important role in regulating fluid and electrolyte balance and excrete the largest amount of fluid. The quantity of fluid excreted by the kidney is determined by the amount of water ingested and the amount of waste and solutes excreted. The client with diarrhea is at high risk of a fluid electrolyte imbalance. When a substance in a client is deficient, either fluids or electrolyte, the substance must be replaced normally by the intake of food and water or by therapy such as IV solutions and medication. When the client has an excess of fluid and electrolytes, therapy is directed toward assisting the body of eliminating the excess. The kidney play a major role in controlling balance in fluid and electrolytes. The adrenal glands, through the secretion of aldosterone, also aid in controlling extracellular fluid volume by regulating the amount of sodium reabsorbed by the kidneys. Antidiuretic hormone from the pituitary gland regulates the osmotic pressure of extracellular fluid by regulating the amount of water reabsorbed by the kidney. Fluid volume deficit, also called as hypovolemia. Dehydration occurs when the fluid intake of the body is not sufficient to meet the fluid needs of the body. The goal of treatment is to restore fluid volume, replace electrolytes as needed, and eliminate the cause of fluid volume deficit. Fluid volume deficit, also known as hypovolemia. Hypertonic dehydration. A hypertonic dehydration is a very concentrated. In hypertonic dehydration, water loss is more than electrolyte loss. In hypotonic dehydration, electrolyte loss is more than water loss. Hypotonic dehydration is less solvent but more water. Hypertonic dehydration, a condition that increases fluid loss such as excessive perspiration, hyperventilation, ketoacidosis, prolonged fevers, diarrhea, early stage kidney disease, and diabetes insipidus. Hypotonic dehydration causes chronic illness, excessive fluid replacement, kidney disease, chronic malnutrition. Assessment, signs and symptoms of fluid volume deficit. Fluid volume deficit means dehydrated. Also, hypertonic solution. When you have fluid volume deficit, you are in dehydration. You are dehydrated and you also have hypertonic solution. The signs of fluid volume deficit are in the cardiovascular, thready, increased pulse rate, decreased blood pressure, flat neck and hand veins in dependent positions, diminished peripheral pulses, decreased central venous pressure, dysrhythmias. In the respiratory is dyspnea. In the neuromuscular, this decreased central venous system activity from lethargy to coma. Skeletal muscle weakness. In renal, decreased urine output, skin, dry skin, poor turgor, tenting, dry mouth. Gastrointestinal, decreased motility and diminished bowel sounds. Constipation, thirst, decreased body weight. Laboratory findings: increased serum osmolality, increased hematocrit, increased BUN, increased urinary specific gravity. In fluid volume excess, also called hypervolemic or hypotonic solution. Fluid volume excess is also fluid overload or hypervolemic. The signs are bounding, increased pulse rate, elevated blood pressure, distended neck veins and hand veins, elevated central venous pressure, dysrhythmias. Dyspnea, moist crackles on auscultation, altered level of consciousness, headache, visual disturbances, skeletal muscle weakness, paresthesias, increased urine output if kidneys can compensate, decreased urine output if kidney damage is caused, pitting edema in dependent areas, pale, cool skin, increased motility in the gastrointestinal tract, causing diarrhea, increased body weight, liver enlargement, ascites, decreased serum osmolality, decreased hematocrit, decreased BUN level, decreased urine specific gravity. Fluid volume excess. The goal of treatment is to restore fluid balance, correct electrolyte imbalance if present, and eliminate or control the underlying cause of the overload. Hypervolemia. Isotonic overhydration causes circulatory overload and interstitial edema. When severe or when it occurs in a client with poor cardiac function, heart failure, and pulmonary